I'm Daniel Water. I'm a psychologist and sex therapist practicing in New Jersey and in Florida. Depression can have a huge impact on sex drive and interest. Depression, it's probably the number one mental health concern, mental health problem in the country. And what depression does for a lot of people is it completely zaps their interest in almost anything having to do with pleasure, activity. They're lethargic, uninterested in things that at one time were very interesting and pleasurable. And so sex, of course, is going to be one of those things that's going to fall by the wayside as people struggle with the symptoms of depression. So medications and depression, medications for depression and sex drive, it's really a very complicated area. If possible, it's much better to treat your depression without medication if you can, only because the medications, then it's usually the SSRIs that we're talking about. They're the most common medications used for depression, things like Prozac and Zoloft and Lexapro. Their side effects include a reduced sex drive, more difficulty reaching orgasm, and for some men, more difficulty maintaining erections. So one of the primary reasons for discontinuation of an otherwise very successful medical treatment for depression are the sexual side effects. So I'll talk about what you can do to try and overcome that, but I also want to add one piece though also about the medication. Why I say if you can do the treatment without the medication, it's better, is because there are some people who, when they stop the medication, their sexual side effects don't disappear. So there is this post-SSRI sexual dysfunction syndrome that is not well understood. It doesn't happen to everybody, but there are people who have reported that after stopping the SSRIs, their sexual difficulties have not resolved. Whether it's because their depression returns or there are some after effects for the medication, we don't really know, but it's a potential complication in terms of sexual drive and sexual ability. So one of the things that we often recommend to patients is, and it's a little counterintuitive, is that most men are accustomed to having the urge or the interest and then engaging sexually. If you can flip that around, a lot of people who are taking medications for depression, once they actually get started, their desire and their interest can increase. So it sort of changes the direction or the sequencing that most men are accustomed to sexually. Instead of drive leading to activity, activity sometimes leads to drive. So that's the recommendation that I usually make to try. So there are several ways to find a good sex therapist. A lot of people will ask their physicians. Urologists in most parts of the country have a network of sex therapists that they work with, that they are familiar with their work, and that they're comfortable referring to. So that's one good place to start. There are other organizations that focus on sexual medicine and sex therapy, and they have referral lists. SMSNA, for example, is categorizing people in the mental health profession. They'll be on the website, and so people can go to the SMSNA website soon and find a qualified sex therapist. Organizations such as STAR, the Society for Sex Therapy and Research, they also have a membership list of qualified sex therapists. And ASEC, the American Association of Sexuality Educators, Counselors, and Therapists, that's an organization that actually certifies people in sex therapy, and they have a referral list on their website as well.